Welcome to Aware and Care, an Ayurvedic series with Dr. Ambika Nair, who's the co-founder and chief consultant at Santhigram group of companies. In this series, we talk about mind, wellness, body care, and everything to do with all the little discomforts this body is facing as we are aging. They say this body is made of flesh, blood, and bones. Well, we do speak about the flesh. We talk about skin care. We spoke about the blood. We spoke about the nervous system. We spoke about the digestive system. But there's something called the bones, the main structure, the entire skeletal system of our body. Even a painter or a sculptor, when he's painting something or sculpting something, he always looks for the bones and the shape and the design. The strength in any design is in its bones. Let's ask Dr. Ambika Nair today the story behind the bones. Welcome to the show, Dr. Nair. How are you?
Yeah, I'm fine. How are you?
I'm doing very good, Dr. Nair. It's a very popular saying that, Nak Naksh in Hindi, they say that, if somebody looks at the structure of a person, when a baby is born, you look at all the physical features and then you start looking at the strength of the body. As they are growing, as we are growing, we come to a point like, for women especially, we come to a menopause stage. For men, of course, they also age and they start, lowering their back a little. The skeletal system, the bones of the body, 206 bones. Do we individually take care of each bone, or there is something that can take care of the entire bone? So friends, if you have noticed, today we're going to speak about osteoporosis.
Yes, osteoporosis. Before itself, there is an elder sister that is called osteopenia.
Okay.
Okay, actually osteopenia, because that is when you start losing the bone density and the mineral content in the bone. That's why we tell, go and take your bone density and everything. But people are ignorant actually. Even, even I can say that because so many people, including the doctors, they don't bother for that. So when you are any asymptomatic, like no symptoms are there, nobody will go. But suddenly you feel little fatigue because your, like energy level has dropped down and you feel little muscle pain, bone pain, that movements are little restricted. If you are intelligent enough, then you will go to a doctor.
Okay.
Then only they will tell that, oh, your calcium level is becoming low. Your vitamin D is very low. Then like they will tell, okay, you go for the bone density and you can find there is like osteopenia. So starting of losing it. Okay, so osteopenia can be always taken care without any problem. In 6 months time you can go back to the normal stage. But if you don't take care of that, what will happen? You get into osteoporosis. Osteoporosis below the level of the normal calcium level. It is actually osteopenia is little bit, but at least still manageable. But in osteoporosis, you start losing a lot of actually calcium and vitamin D will be there. Okay. Then first of all, how they will complain. Some people will have headaches. Some people will have pricking pain in the bones. Before they cannot get up. Some people experience little low grade fever also, and they become susceptible for all the inflammations. Some people are like that. They get very chronic cough and even vertigo when they get up in the morning, pain in the lower back. Sometimes it will not be on the lower back, maybe on the thoracic side, pain in the chest. They will tell, oh, I have like in between my breast, that bone, I have lot of pain. I have like in between the ribs, I have pain. Such a moving pain also comes like that. Okay. And the ribs, the fingers become very, very stiff in the morning. Sometimes slight swelling will be there. Sometimes may not be there. Not only that, they will tell that because when they lift the things, they feel very as if the things are dropping. So there is no strength.
So the grip is not there.
Yeah, no strength at all because they cannot, things start falling from their hand.
Okay.
So this is also paralysis. Okay. So because actually there is no strength in the bones. And, that is one of the things, how they will be explaining. And they feel like so tired. They don't want to get up and, move. They want to lie down more. So fatigue.
So receding gum line also is part of it, or it's a completely different subject? or it
No,
could
no,
be
no,
on the
no.
symptoms?
Receding gums is also there. You can notice, but seldom people will notice all those things actually. Okay, because they will tell that maybe slight bleeding will be there from the gums and all. Okay, and the crooked teeth. Teeth also, because, yeah, this is a very good question, Madhavi, you asked me, okay, about the teeth. They can chipping of the teeth,
Okay.
like a powdering of the teeth. In osteoporosis, it is very common actually. They will
Uh-huh.
tell, like, because I feel some sand type things in my mouth.
Right. Okay.
People will, yeah, people tell like that. So then we will tell, when we will see that how the structure is diminishing. Okay, because that how the teeth will start, like you can see the cavities, more cavities.
Mm-hmm.
Okay, so this all because of the absorption of calcium is very less in the body.
Okay.
Okay, so the one big cause for that is that because like a thyroid gland, we have like a hyperparathyroid gland also.
Uh-huh.
Okay, so that produces like a parathyroid hormone, which controls calcium, phosphorus, and vitamin D in our blood and bone.
Uh-huh.
So when the calcium level is low, body responds by making more like hormones in that parathyroid hormone. So
Mm-hmm.
this hormone, causes calcium levels in blood tissue to rise.
Mm-hmm.
So more calcium is taken from the bones
So,
and
doctor, now that
reabsorbed by the.
you've given so many symptomatic symptoms about osteoporosis, I just wanted to understand a little more there before we get into the more detailing of the subject here. What is the difference between arthritis and osteoporosis? Does one lead to the other, or the other leads
Arthritis,
to this?
osteoporosis may not have swelling.
Okay.
The
Mm-hmm.
bones will become brittle.
Mm-hmm.
Okay, but whereas in arthritis, osteoarthritis means swelling will be there, rheumatoid arthritis, osteoarthritis, there are so many arthritis in that. Okay, so you won't be able to move. Your movements are restricted. Here you can move, but
Mm-hmm.
you will get a fracture.
Okay, the bones become a little brittle.
Yeah, arthritis people will walk,
Mm-hmm.
at least with the difficulty, but here you won't be able to walk. If you touch somewhere, you will get a fracture. It's not a must, like I'll tell you, because actually recently one of my, because her mother was very, very smart looking. She moved to Maryland. So she told me, like my mama, she was very good, very, very good looking. She's from, I should say, she's a Pakistani girl.
Mm-hmm.
Okay. So very, very beautiful lady.
Mm-hmm.
So she could not, like one fine morning, she got up, she could not get up because there was a fracture in the spine.
Oh.
Okay. So, like a bucket, she did not pull anything, she did not do anything because the movements of what she did at, at night, it caused. So, why it happens? Because the bones are so fragile. So, even a little bit of pressure can
Uh-huh.
cause a fracture.
Okay.
You
So,
must be also listening, like she did not do anything, she just pulled something and the wrist got fractured, like because it is very prone for that. So there is no life. I am telling density is very low.
so,
This is like a driftwood.
doctor,
You
so
understand?
is this a progressive disease, or it just comes up suddenly, or you start some
No, no,
at
no,
some
no.
point
It
in
comes
life?
up. It is a very progressive disease because first it comes at osteopenia. I told you.
Mm-hmm.
Then only it will come like osteoporosis because sports are there. Sushiram.
Mm-hmm.
Okay, so that will be there.
That's interesting to
Yeah,
know.
that is there.
And so, osteoporosis that we are talking up today here in Aware and Care. So, friends, if you have any questions, please do key in the comment section. Doctor will be kind enough to answer them. So, osteoporosis, is it anything related to age, or it can come and strike at any age? Are children born with osteoporosis?
I never saw any child born with osteoporosis.
Okay, babies. I
Okay,
would
but
have to correct
very,
myself.
very few cases I have, some people were telling, I have
Mhm.
seen in the news and all, but not like I never treated any child with
Okay.
osteoporosis.
So this is
Arthritis
definitely
is
seems like a
common.
progressive disease which comes with you're not taking good care of your body. And so
Yes.
what are the reasons behind osteoporosis? How does one get it?
Osteoporosis, like some people taking like some asthma.
Hmm.
So like, like the child is having asthma, they treat with corticosteroids.
Okay.
Okay, some people with epileptic cases, they take those medication for a long time. Okay, another thing is that they take like diabetes, so the calcium absorption is very less.
So,
So
doctor, when you have another
arthritis.
underlying condition and you're taking medications for it, that is affecting the bone. So, I'm sure those particular medications will come with a substitute which will supplement the bones or other aspects of the body. So they have to go hand in hand. So because many times when doctors prescribe medicines, they also give you some multivitamins, and people think, oh, it's just a multivitamin, let me not take it. But here you've mentioned a very interesting point, like even any of these underlying conditions where people are taking medicines, even like steroids here, if they have been given some supplement medicines, multivitamins, they should take. And calcium is one of the most important mineral here that we are talking.
The proper amount of calcium should be taken. People take sometimes more calcium, and the food habits are also. Some people only eat only like like monotonous. They will be taking so much of aerated water. This all like not at all good for them.
So
Very
does
cold food.
osteoporosis specifically hit a particular bone, maybe the hip bone, the ribs, or the spine? How does it work?
No, in old people you can see like that they will always have hip joint issues. Hip
Mm-hmm.
replacements are there, but like in knees and all it is very less, but the small bones will get, especially on the finger and all those things, and not only that, as it become hollow, like there is nothing, it is actually hollow, then what will happen, it is like pores are there, that is called, it is osteoporosis. Okay, pores are there, so it can, if you touch somebody, like if you open the door, even sometimes you can get a fracture because you can't apply any pressure. That's why it is such a dangerous condition, you cannot even move, and they lose weight, and the loss of appetite will be there. They get a nauseated feeling, they don't feel like taking any food. So this all like interconnected actually.
So we've just understood all the symptoms and the aspects that lead to osteoporosis. So a person with osteoporosis is finally knocking the door at the Ayurveda Center at Santhigram. So before coming to you, do you want us to bring certain papers or documents or medical reports, or we just walk into Santhigram and say, my bones are hurting, they've become very brittle?
No need. Some people, Madhavi, some people will not come with anything like that. They will tell that I have confusion.
Uh-huh.
I am forgetting the things.
Oh, it starts from there.
Okay. So this all, like then, like anorexia, because my height is becoming, less.
Mm-hmm.
Okay. Little pain while walking because they are too busy, they engrossed in their work like anything. So they will tell, at the last, they will come and tell me like, oh, I have this issue, I have that issues and all. Okay. Then, like we check and we'll tell them, like because what you are having, whether you have any problem in the thigh, whether any numbness in the thigh, like thigh muscles, okay, or the calf muscles, any, they will tell that because I can't even, like understand whether my muscles are there because sometimes walking. So this all we notice it, like a pulse analysis it is. So when we take care of that, then we will tell them what they should do. They should have a, like it's in the osteopenia, total lifestyle changing.
Okay.
I will, like in 6 months, they will become perfectly all right. There is no doubt. If they follow whatever I say, it's not
Yes.
that because only I tell them they don't listen means it's difficult for me. Then, I get a big question. Okay, we are vegetarians. We cannot eat salmon or anything like that when the food comes.
Uh-huh.
So we tell them, what in vegetarian, what to eat, like tofu, all those things, we tell them how to eat it, okay, and what nuts they should take. According to the constitution of the person, we change them. And whether they should, like they should stop the sweets, like bitter, pungent things they should eat.
Mhm.
They should, I always tell that, oh, cruciferous vegetables will not help. But in this osteoporosis, they should eat all those things.
Wow.
Okay, broccoli.
Finally,
Yeah.
we get a recommendation for cruciferous vegetables.
Okay, so like kale, Brussels sprouts, broccoli, I recommend for them actually. Yeah.
So, doctor, I
See,
think this is going to be my favorite question of all time because Ayurveda, there is so many misconceptions and myths out there, and you've been
ask
kind
me
to,
anything.
and you've helped us to understand so many things. When a baby is born, culturally, where we come from, we talk about baby's oil massage, make the bones strong and everything. So, when I am having a bone problem or anybody out there with osteoporosis, the first recommendation people generally think, go to an Ayurveda center, get a good oil massage, and all your pains are gone and your bones are intact. Please clarify this myth or the fact.
it is a fact actually, because especially in South India and whole India, I have seen that how they do the massage for the children. But if the child is having any skin problem, then we will give them, where we recommend a different Eladi oil or Dinesha Vilyadi. Okay, but to strengthen the bones and this one, we will be giving them Shira Bella, Lakshadi oil,
Mhm.
and even Bella, like Ashwagandha Veladi oil, because that is very nice for the children, and even Mahanarayana. But when the problems are there, otherwise, normally with the coconut oil, we'll be doing it. It helps a lot. So to keep away, because actually, see, if massages means it improves the circulation. So the child will be more active and they will grow very good. They will cry at that time, but who bothers for that? We want the child to be perfectly all right.
Mhm. So what about adults when they come to Santhigram and you have diagnosed that it is osteoporosis? How does it work? What are the steps after that?
Osteoporosis, sometimes we may not take the case just for, because if it is very worst case, we
Uh-huh.
will not advise them to come for Panchakarma.
Okay.
Okay. Because they are, if the body is okay, only we can do. If they are very fragile, then when we touch it seems, then they are prone for fractures. So they are very, like the high risk patients they are. So then, like we will be giving them, we have very good medication for that to strengthen it. So we will be giving them, like a Gulgulu Tittavam is there, Maharasana Kashayam is there, Asanadi is there, Ashtavargam. There are so many, like bitter medicines are there.
Friends, as you're watching, you just heard Dr. Nair say that if your osteoporosis is very severe, they would not start the treatment immediately. They will work on strengthening your bones first and then work on the treatments. Dr. Nair, when you talk about strengthening of the bones, are there any foods that we should inculcate in our daily lives and eat more to strengthen our bones? Even to avoid osteoporosis, or as a general suggestion to what are the foods that we should be having, whether it's nuts or fruits or any kind of oils?
No, because actually the food, like because they will be having little anorexia and
Mhm.
loss of appetite, and they feel so tired. They feel that because they will not be perfectly all right, so that creates a lot of depression
Uh-huh.
and fatigue. They cannot move. Their movements are restricted. So we make them, counseling is done. We take them into confidence. Come after 1 month, after following whatever I am telling, then you can see the difference. That is more important actually.
Uh-huh.
Then we give them, special decoctions will be given to them, bitter decoctions,
Mhm.
ghee preparations will be given, but in small amounts,
Uh-huh.
because otherwise they will not digest it.
Mhm.
And we will be giving them diet, proper diet, sunflower seeds, almonds, all those things we tell them. And the cooking can be done, if they like, they can do in olive oil or in, sesame oil. So this all we will be making them understand, but like it's very difficult, they will think that that will be the end of their life.
Mhm.
So little bit of, like care will be given, so they gain the confidence in that. And the
So,
fruits like
oh,
guava,
mhm.
okay, pineapple, papaya, all these fruits can be taken. They will start taking slowly. And like then if they are non-vegetarian, we tell them, see, in Ayurveda they will tell you don't advise non-veg, but whatever the rich calcium food has to be taken.
Mhm.
So we will tell them, they can take salmon, like even sardines,
Mhm.
milk, milk products, cheese. They can take cheese, and all the vegetables like broccoli, all those things. We tell them to take it, but it should be cooked so that it will, like digest and assimilate in them.
So what about these multivitamins, over-the-counter medications, or calcium supplements? Do you advise that? I mean, of course, everybody has to take the doctor's recommendations, but just putting you in a spot that when people just pop up all those instead of the natural way of healing the body.
Madhavi, is a very good question. Actually, people only don't like to go to the doctor and ask for all those things, because
Mhm.
they feel that, oh, they are diagnosed and they are, like a person with a disease. It's not a good thing to do. Actually, how much amount of calcium has to be taken, how
Mhm.
much of everything, in the particular way it will
Mhm.
be prescribed. Then only the doctor will be able to help the patient.
Mhm.
Otherwise, whatever you take, it's like you're pouring water on a plastic sheet. It will not get absorbed in the body. So too much. So if you have any problems, you should always go to the doctor and see that what is your issues. And the doctor will advise you to go for the hormonal, like test everything. and your, like bone density. And even in male also, we have seen if the testosterone level is less, they get into osteoporosis a lot.
There is a connection there.
Yes.
So I come to that part of the program where I have to ask this question of hope, and all our viewers always say that, that is a very important question. Sometimes I mix it in between, sometimes ask you at the end. I want to ask you now, because of all the information that we got in this program regarding osteoporosis. Osteoporosis is curable or manageable?
It is, see, osteoporosis, if it is very bad, it is only manageable.
Mhm.
Okay. But if you come when you are having like starting of osteoporosis, then it will be curable also. Because
Yes.
till there, what happened, but no much more proceedings will be there. More deterioration will not be there.
So there are stages in osteoporosis.
Yeah, because actually too much, if the person cannot even move out and all, because how you are going to help them? Because we won't be able to help, like they won't be able to eat also properly because they can't move. We get some cases like that. Can you cure me within 3 days? How can one do it? It's very, like tragic
Because
to ask such
Dr.
question.
Nair, I mean, I can't be saying anything much here, because I know people have this belief that Ayurveda is a last resort, and it has a magic mantra of healing you in one day, which of course you're just right now reiterating that it is a process. You took so many years to spoil the body. It will take a little time to at least heal the body.
This thought process is not with our people actually. Some people
Mhm.
will come, oh, I know it takes a lot of time, but it does not take a lot of time, but it takes time.
It
And
takes.
even, it is genetic also. Some people you can ask the patient the history also,
Mhm.
whether the father had, like your mother had osteoporosis, the genes are also there. And
Mhm.
menopausal time, every lady should take care actually. Sleep is also, if the sleep is less also, it will happen like that. People will complain like that. There are so many symptoms related to this actually.
So fatigue, body pain, menopause, hereditary factors, and of course
Headaches,
bad diets. You saying something, doctor?
headaches.
Headaches. So there are so many aspects related to it. It is best to consult a doctor when you see the first symptom and you get the alarming sign from your body saying that something is not right. So let's get to home remedies. And in home remedies, I definitely want to ask you that, is it good to have oil massages on a regular basis at home?
Everybody should do that. Actually, if I say something like that, they will tell that where we have time.
Uh-huh.
Find some time, at least weekly once, that most of the people are working only 5 days a week.
Mhm.
So take out at least half an hour for yourself to pamper yourself.
Mhm.
Okay, like you can use Dhanantram oil, Mahanarayana oil. If
Mhm.
no oil is available, you can use your, like a mix castor oil and sesame oil. You can massage your body. Massage always helps a lot because it improves the circulation and it maintains. It's an anti-aging process also. If you practice like that, you will go to the doctors very less.
And doctor, when it comes to comfort and discomfort, do you think cold compress or hot compress, what makes the body comfortable when somebody's suffering from osteoporosis?
Osteoporosis, I should say that it should be a little bit of warm, not very hot. They
Mhm.
won't be accept anything like that.
Okay.
And even both cold and hot we give them in alternation.
Okay.
Okay. But sometimes it will be very painful. Then mostly I have seen that we give only warm compress.
What about painkillers?
Painkillers here, there, so many are available, they will take it. We don't give that actually.
Yeah, you don't.
We give them gulgulu so that the bone density will increase.
Mhm.
There are so many supplements which will help in, like in calcium,
Mhm.
that we tell them. Vitamin C is more important. So now the weather is coming, so everybody should eat, orange. Orange is very good actually. So vitamin C is also required for all the calcium absorption.
Uh-huh.
Vitamin D, vitamin C, calcium. Take a lot of, like buttermilk. If yogurt is not, because if you have cough and cold, you can always depend upon taking buttermilk, especially in the afternoon time, not at night. Okay, so so that you don't get another disease. That's what I'm telling.
This
Because
could
when
lead
you
to a lot
have
of
this
other
all these
problems
things,
later.
yeah, when you have all these things, your immunity will become very low. Okay, so try to boost your immunity. Turmeric is very good.
Mhm.
Yeah, this all you
So
can
a lot
take.
of home remedies that we could start trying right now. And of course, like again and again, and the starting of the program and during the program, we give you a statutory information that please do not try all the remedies on your own at home. These are slight things to make you feel comfortable before you reach the doctor and, reach out to the doctor. So Dr. Nair, thank you so much for today's episode. Is there any parting note that you want to share with all our viewers, which you think that we missed out and you wanted to share today?
Yeah, take castor oil. One minimum, like 1 teaspoon of castor oil with warm water you can take. See, and watch out whether you have any constipation. Constipation also, creates all of this stenosis and everything will come like that. So if you have a chronic constipation, instead of, taking all other, other medicines, you should always seek the opinion of a doctor so that they will guide you properly. So castor oil is very good. 1 tablespoon of castor oil with warm water at night. It will really help you a lot.
This is like that typical Ayorama moment, because grandma's tales about saying, take castor oil, it keeps your bones strong. So basically we're talking
It is. All grandmas were good, yeah, especially in India.
Absolutely good. Thank you so much, Dr. Nair. It is always a delight to be talking to you and learning so much how to take care of this body. And today we are talking about flesh, blood, and bones, and we stressed on bones today, osteoporosis. And friends, if you have any questions, anything that you want to ask, feel free to reach out to the doctor, or you can put a message here and we will cover that particular topic. Thank you, doctor. Until next time, aware and care. Thank you.
Yeah, take care so that our bone only, give us a structure and then a good look. If you have a crooked bone, you will not look good. So take care of the bones. Thank you so much.
Thank you.